Welcome to the Gladden Longevity Podcast with Dr. Jeffrey Gladden, where our passion is helping you to become an age hacker. On this show, we want to help you optimize your life energy, longevity, health, and human performance with impactful and actionable information by answering 4 questions. How good can we be? How do we make 100 the new 30? How do we live well beyond 120? And how do we live young for a lifetime? Now, here's today's episode of the Gladden Longevity Podcast.
Welcome, everybody, to this edition of the Gladden Longevity Podcast. I'm here, Dr. Jeffrey Gladden, as your host. And as always, we're answering 4 questions at least, and maybe 5. The first one is, how good can we be? The second is, how do we make 100 the new 30? How do we live young for a lifetime? How do we live well beyond 120? And how do we curate a 300/3,000-year-old mind? And today, I had the pleasure of speaking with a physician, a plastic surgeon, actually, from the UK. Really a fascinating conversation with Charles Nduka. That's spelled N-D-U-K-A. We're going to talk about some really interesting things related to people with facial paralysis, but also beyond that, a way that he's figured out to sense what's going on with people's faces, their emotions, their eating habits, and it's really quite dynamic. I'm really excited to share this podcast with you and actually get a hold of his technology. So I hope you enjoy this as much as I did. Thanks. Welcome, everybody, to this edition of the Gladden Longevity Podcast. I'm your host, Dr. Jeffrey Gladden, and I'm here with Charles Nduka. Did I get that right? Am I close?
Yes, right.
All right, good. All right. So, Charles, tell us a little bit about how you got into facial recognition and joy. I like this joy span as a term for longevity. I don't know if you've seen any of the work that we've done, but we're really big on the life energy elements, one of which is joy, of course. So tell us a little bit about that. How'd you happen into this space?
Well, thanks very much for having me on. My name is Charles Nduka. I'm a plastic surgeon by background, and I've been specializing in facial reconstruction and plastic surgery for the last 25 years. I specialize in facial palsy, facial paralysis, which can be due to Bell's palsy, you may have heard of. Also many causes, tumors, accidents, strokes, etc. And it causes tremendous devastation to patients, not only physically, unable to smile, close your eye, just do normal things we expect to be able to do, like speaking clearly, interacting, eating, but also just that natural thing you do when you meet somebody for the first time, you smile.
Sure.
And being unable to smile causes tremendous distress to patients. The surgery I do is to help to restore patients' expressions, help to restore their movements as far as one can. And
how do you do that? How do you restore that if they have a nerve palsy? Are you actually kind of working with the nerve itself, or are you kind of restructuring the face to where it hangs in a more useful emotional state or functional state? Yeah.
So it depends on the cause. Facial paralysis can be due to an accident. So a surgeon has cut the nerve by accident. In those cases, we would aim to find the cut ends and repair them quickly and accurately as possible. Mm-hmm. Sometimes we don't get referred the patients early enough, in which case the muscles have wasted away. And so you have to then restore movement by transferring nerves and muscles from elsewhere. And it really depends on the cause. If the patient is very young, they often do much better. If the patient is very elderly, nerve regeneration is less reliable in those cases. So you tend to use more local techniques, either static or dynamic. So you can, for example, move the muscle that moves the jaw, the temporalis muscle that's on the temple, and reroute that and turn it into a smiling muscle. So you can give.
Got it. So do you work with pediatrics as well? People of all ages, or is your practice more 18 and above, or how does that work?
So I do see children, but most of my practice is adults because the larger surgeries, we don't have a dedicated pediatric unit. So I often get consulted with younger patients, and very often, especially these days, patients are actually often choosing to have surgery and be involved in decision-making, which often is when they're older.
Mm-hmm. Got it. Well, that's interesting. Then you're noticing that younger people heal faster, heal better, heal more completely than the elderly people, is what you're saying, right? So do you have any strategies to help the older people catch up?
Well, I mean, this is one of the big failings of healthcare because we often try to address things after the fact. And obviously, well, but it's not that commonly known amongst many doctors how much difference lifestyle has on patients' abilities to recover. So things like smoking,
Hmm.
things such as metabolic diseases, diabetes, for example, have a big impact. Um, we obviously, I'm quite strict about smoking. I don't let patients smoke in the lead up to surgery because it does have a very bad effect on wound healing and recovery.
Hmm.
And they shouldn't give up smoking too soon before surgery because otherwise they can often have a rebound respiratory infection. So it's important to give a good deal of
Right.
time to get
Does
over
that
the
go for all forms of tobacco or predominantly smoking?
predominantly smoking, to be honest, predominantly smoking.
Mhm. Okay.
So yeah, and so the surgery is really to try to help patients reintegrate, to help them to do that one thing that we do every morning. You go to the bathroom, you look at yourself in the mirror, and you see what you're expecting. For patients with facial paralysis, they often see something that they find distressing.
Hmm.
It often makes them feel embarrassed, shy to go out. They often isolate themselves. And I did a study just about a dozen years ago, uh, looking at a series of patients in our service, and just found a really high incidence of depression and anxiety as measured
Yeah,
in standardized assessment scales, the
sure.
hospital and anxiety depression scale. And that really led me down this pathway to see, what can we do to help these patients? Because it's not just about restoring muscles, it's not just about restoring nerves, it's not even just about restoring smiles. It's about helping patients to express themselves, to interact with each other, and to socialize essentially.
Hmm. Yeah, absolutely. It's yeah, the face is critical. It's for better or worse, it becomes part of people's identity, right, in a way. And so when it's disfigured uh, in their eye, and I suppose other people's as well, particularly their eye, then it's something that they're very self-conscious about. So, do you have a psychological team that works with these folks as well?
Yes, yeah, absolutely. I'm really lucky. We have a fantastic team, psychological therapists who sees all patients before I see them actually.
Oh, cool.
And that's something that we set up at the very start. I set up the service in 2007, and it was always very important to me to have a multidisciplinary team. The unit is in a hospital called the Queen Victoria Hospital, which was made famous because of the work done in the Second World War. The burnt airmen, who oftentimes, again, were disfigured,
Yeah.
often themselves away from life. And the surgeon, Sir Archibald Mackinder, plastic surgeon, he set up a service where he very much worked in partnership with his patients, and it's something I try to do. So I have a
I
great
see.
team of facial therapists, psychological therapists, and then we
Right.
work collaboratively with other surgeons as well.
Nice. Yeah, that's great. I think I think integrating, treating at the whole, individual as opposed to just the anatomy, right, is really the key. Um, and so with that sort of team approach, how does it work out? What percentage of your people kind of get restored to a point where they feel like they've reclaimed, let's say 90+% of their life or 85% plus of their life, or how does that work? Yeah.
Well, one of the things that was really quite surprising for me was, so in 2012 we did this study. We found this incidence of depression and anxiety, which we kind of knew intuitively, but it's good to document that in a rigorous peer-reviewed study.
Hmm.
But as a doctor, patients don't always tell you how they're doing, how they're feeling. They feel often very grateful. Sometimes we do operations that take 4-6 hours, sometimes in two stages, and so you don't really get a good impression by asking patients, how was it? I set up a charity, Facial Palsy UK, with colleagues, and that gave me the most valuable insight that I could get around the role of facial palsy in patients' interactions, because very often patients would have surgery, but they wouldn't necessarily go out in the world and interact. They still felt that there were issues
Hmm.
that they were dealing with, and this is why we have this peer support group.
And that's the
Which
charity's focus, is to actually help those people reintegrate or work
absolutely,
through the trauma, so to speak. Yeah.
exactly.
Okay.
And so I discovered that, and this is what's been really, really valuable. We did a further study which we found the correlation between the degree of severity of the paralysis and the patient's psychological impact wasn't that well correlated, because, and I'm sure you've seen it in your own life, some people have a very high degree of focus on their appearance, and other people not so much.
Mm-hmm.
I have two patients, one patient with a very dense paralysis who, just said, okay, well, doctor, just help me to stop dribbling or help my eyes close. Another patient with a very subtle asymmetry in their smile, for whom they feel their life is over and that they can't go out. So that psychological element was really, really important. And it made me realize really that as doctors, we don't really get trained around understanding what matters to patients. This is why we set up the company, and the strapline is measuring what matters, because ultimately it's what matters to patients that we should be focusing on, not necessarily what's important to the doctor.
Yeah, I think that's right. I think there's a couple levels there. I think it's a question of what matters and then why it matters to them, right?
Exactly.
To go a little deeper. No, it's exactly right. It's very rich, sort of fertile ground to kind of go into, particularly with something as sort of obvious as this, right? So,
I often say to patients or say to colleagues who sort of, they sometimes consider it as being a cosmetic subspecialty, but actually it isn't, because the face's form is its function.
That's right.
Its function is its form. So the two are together. And unless you've experienced facial paralysis, you really can't comprehend what an impact it has to lose your identity, to literally overnight, in some cases, to not recognize yourself in the mirror. And that's how fish discover water last. Until you've lost the ability to express yourself as you intend, it's hard to fully comprehend it.
Yeah. No, I agree. I'm sure it's stunning, absolutely stunning, depending on the, level of disability and your perception of it. So, again, back to, what percentage of people end up making, good progress here? Is it with the team approach? Are you able to get the majority or a minority, or how does that actually work out?
So thankfully, the majority of patients make a good recovery, both in terms of their self-perception. We do obviously objective assessments using some scoring systems, but also, we ask patients as you'd expect. There are patients who, despite objectively having significant improvements, they still, want to get back to where they were before. And sometimes, it's a one-way street. You can't do that. Added to that is the fact that people are often experiencing secondary issues such as aging. And if they are, so one patient, she had this terrible accident when in her 20s. I've been seeing her for 15 years and as the face ages, the side that wasn't affected will age. And so the reconstructed side needs to kind of be adjusted to keep up, because it doesn't age in the same way because it's not moving as much. So it's important to kind of recognize that and tell patients up front that your face will change over time, and there will necessarily be some balancing procedures that are required. And I'm really glad to say that many patients, not only are they end up being happier, but certainly those who carried on by getting involved in the charity, they actually can pay that forward by helping those new patients who've also been affected, to help them to realize that at the end of the world, that you are in your face. That yes, the face is important, but it doesn't mean that you aren't a whole person.
Yeah, I was involved peripherally with a charity in the U.S. here called Oscar Mike, which is basically devoted to military veterans who have been, could have suffered any injury, but they have some sort of disability, and they put together this charity. And it's saved the lives of many people, because, as you probably are aware, it's probably true in the UK, military service personnel who are damaged have a very high rate of depression and suicide. And they have over 1,000 members. And to date, the last I checked, which was a few months ago, nobody had committed suicide. Wow. And it's all built around social engagement with each other, playing games, like they're playing wheelchair rugby and they're playing, checkers and whatever they're playing, right? But they're going outside, they're climbing a mountain in their wheelchair, they're doing all kinds of things that stimulate the ability to participate in life with people that get you, right, and that are cheering for you, right? And that's such a strong thing. And so I just wonder, in the charity that you have, if it mirrors some of those same principles, where you get people up on stage and they tell jokes and other people laugh and things like that. Is it that kind of charity?
We had a comedy night just before the pandemic. We had a comedy night, which was great. We have family days when we get kids who've never met anybody else affected in the same way.
Right.
And many of them become, bosom buddies, pen pals, and
Right.
continue
Yeah.
interacting beyond that day. And a lot of people, there's a psychologist called John Cacioppo who sadly passed away quite recently, who did some amazing work, actually initially on facial EMG, which we'll probably come to later on. But he did.
So EMG for the audience, just describe EMG.
EMG stands for electromyography, and you can consider it like an EKG for the face.
The muscle.
Yeah, for the muscles. So he was a researcher psychologist, but he did some really interesting work on the impact of loneliness on health. And if you get a chance to have a watch of his TED talk on loneliness, he showed that loneliness has a bigger impact on your longevity than smoking, than high blood pressure. Right. It's extraordinary.
It is. Depression the same way, right?
Exactly. Yeah, we're social beings. Yeah. So there are people who are not ill, they're not service people, but who will take their own lives because they just feel desperately lonely.
That's right.
And even if they're not doing it directly like that, they can do it indirectly through behaviors, through drugs, alcohol, etc.
Yeah, that's right. So it comes down to a question of, I think, acceptance, self-acceptance, acceptance by a peer group on some level, and then finding meaning, right? A way to contribute, a way to participate, a way to learn and grow.
Exactly.
These are all vital to us as humans throughout our entire lives, quite honestly. It's just that they've been put into a situation where the typical avenues don't necessarily always work for them. And so the charity is focused on creating those avenues, right? Where they can reclaim that ability to live and grow and have meaning in relationship, right? So,
Totally. And it was really interesting. Obviously, as a surgeon, I didn't set out to do sort of a charity, but it made me realize that surgery is inherently unscalable. I love surgery, but you help one person at a time.
That's right.
You have a charity, you're able to help multiple people over time.
That's right. Yeah, no, that's very cool. It's very cool that you did that. I think you also developed a set of glasses. I saw something. Tell us a little bit about that. I see you're wearing glasses. I'm wearing glasses, but I don't think these are the glasses you're talking about.
No, these aren't the glasses. I have a pair down here to show you. But so one of the things that we all are affected by as clinicians, as doctors, is that you can help a patient within this thin slice of time, that consultation. You're with them for whatever, 15, 20 minutes, 60 minutes even. But very often, even though the patient knows what they need to do, they sometimes just don't do it for whatever reason. And I found with facial paralysis, patients, when they've restored the muscles and nerves, they need to do the exercises to rehabilitate those muscles. They need to now learn how to synchronize and symmetrize their smile. Otherwise, things become scarred and tethered, and they don't get an optimal outcome. Now, one of the difficulties is that patients after an operation, especially like this, they don't often like looking in the mirror. And so getting guidance on the expressions as they're making them is very difficult. And actually, a patient said this, we use EMG, we use this device in the clinic to give patients better feedback around what the muscles are doing, because unless you're sort of walking around all day with the mirror, it's very hard to learn what the muscles are doing.
Right.
And he said, well, why can't I have one of these machines to take home with me so I can practice my expressions as I go around my day-to-day life? And obviously that's not practical, but it did get me thinking, what if there was a way of developing a wearable device that gives the person the ability to get feedback on their expressions as they go about day-to-day life? Because in addition to that, the clinician could get information about how the person's doing. And if they're not making progress, they could call them in earlier. Very often as doctors, whatever specialty, I think you're a cardiologist, and you need to be able to understand the patients. They tell you that they're feeling a bit tired, fatigued. You think, well, have they got AF? Are they having arrhythmias? And it's great. You can give them a device. They can take a Holter monitor, look at the blood pressure, or look at the ECG or ambulatory blood pressure. But we don't really have that for the face. There's nothing that you can use to get real-time, real-world information.
Right. And so, apart from a mirror, right? Apart from a mirror.
Yeah, exactly. And because patients wouldn't look in the mirror, they weren't making progress. And so, we started down this pathway of developing a system for measuring facial expressions in a real world setting. And that was the beginnings of the company.
That's awesome. Yeah, because what you're really doing is lowering the threshold for somebody to be able to participate in their own rehab. Because even if you have a mirror, even if you're willing to look in the mirror, you don't always have a mirror, right? And so with the glasses, I assume you can walk around and live your life and then sort of monitor yourself in your daily activities, which would be like, oh, okay, this is cool. I can say hi to somebody in a grocery store, and I can, smile at a small child. I can do, whatever you would do, right? And you're getting feedback all the time, which is reinforcing. So that's fantastic. Yeah.
One thing that's really interesting about facial paralysis is that because patients don't want to express asymmetrically, they'll very often suppress their expressions forward. And in doing so, they're actually having a negative impact on their mood.
Right.
So there's a series of studies done in the 1980s and later replicated a few years ago that demonstrate this facial feedback process, whereby if you make an expression, you'll reinforce the emotion that it's portraying. So the original research is quite funny. So what the researcher did was to get people to put a stylus between their teeth and between their lips. So between their teeth was to trick them into activating the smile muscles because the stylus was going across their teeth. Or they held it between their lips as if they were blowing through a straw. And they told them it was a study on human-computer interaction for the disabled. But what they were doing is just tricking them into activating their smile muscles and then showing them some videos that were ambiguous in terms of whether they were positive or negative. And they found that basically, and this was replicated numerous times, when viewing something that was ambiguous, but while smiling, you tended to interpret it more positively than negatively. Then subsequently, they did a subsequent study where they got people they glued golf tees onto their foreheads and asked them whether they could bring them together. Again, they were tricking them into furrowing their eyebrows.
Right.
And similarly, they found that when you furrow your eyebrows, you tend to interpret ambiguous information more negatively. And the study's been replicated multiple times, and it's backed up by the work that's been done with Botox. So, for example, it's been used to manage depression. And you know this, that patients, people who express negatively, they often will experience negativity from those around them. And again, this person now is part of a feedback system with those around them in the society.
Yeah, it's interesting, isn't it? I mean, you sort of think of that it starts in the brain's perception, but there is a direct link to the mechanics of what we do, right? That's an interesting feedback loop. So you're starting with the face and then looping it back into the brain. Very, very cool. So do you have a prescription? Are these like prescription lenses that somebody can walk around and read a book and see where they're going? Is that how it works?
Yeah, absolutely. Yeah. So our systems are quite, they are still prototypes. And so we're doing some studies with them. I can show you them. They don't look too dissimilar to regular glasses. They're just slightly thicker on the, there you go.
Oh yeah.
Yeah,
I got it. Yeah, and they look like regular frames, so just a little different color. I don't know, is there something to the color, or
they're a little bit thicker on the side there?
On the temple.
Lenses pop in and out, so we have prescription lenses for them. And
so, is it the frame that's actually doing all the sensing? Nothing to do with the lens? Is that the idea?
Yeah, that's right. Yes, we developed some new sensing technology called optomyography, which essentially allows us to sample facial movements with very high fidelity, high sensitivity, but using very low power and with a very small sensor footprint. So it's pretty small. It's kind of modeled a bit on how a fly sees basically what's called optical flow, where the tiny texture changes across the sensor are detected across in the XY plane.
Okay. And is there a little battery then in the frame? Okay.
Yeah. So you take the glass off at night time.
So do you charge up your glasses at night? Is that what happens? Okay. Yeah. Got it. Very cool. And so is this something that's, you go to a website and buy it, or is it something that's being studied in research only now, or how does that work?
So we did some research published in Frontiers in Psychiatry where we demonstrated that you can detect differences between depressed versus non-depressed people just purely from their facial data, which was fascinating. Okay. And we see this in future as being a way to enable psychiatrists, psychologists to study mood disorders in the wild.
Yep.
And so with that, as I say, you can do with a CGM or looking at blood glucose or ambulatory ECG. In terms of the glasses as they are now, we're using them mostly for research, and we're working with some partners. So the main use case we're using just now is around diet monitoring, because we see that as being a huge potential to help a lot of people.
Diet monitoring. So tell us about diet monitoring with facial expression. So if you're laughing, you eat less or you eat more?
Well, actually, so one of our developers, whilst he was doing some debugging, was having his breakfast, and he noticed that every time he took a chew, he could see the signals very clearly. Now, the glasses weren't designed to measure eating behaviors; they're designed to measure emotional expressions.
Sure.
But because there are sensors in the temple that are there to kind of calibrate for different movements of the glasses, they were picking up the muscle activations at the temples. Okay. And so I got talking to one of our colleagues who's a researcher, but he's also a bariatric surgeon. He said, well, that's amazing, because dietitians, one of their big bugbears, that they try and get people to change their eating habits before they undergo bariatric surgery to reduce the stomach. We try to get them to eat smaller amounts, to chew more thoroughly, and to give a gap between mouthfuls. They call it 20-20-20, where it's 20 pence a piece of food, chew at least 20 times, and have a 20-second gap between. But patients often don't do it, because a lot of people who are overweight actually have grown up just learning how to eat very quickly.
Yep.
They get it from their parents. So retraining that is very, very tough. And he said, well, talked to some dietitians, which we did, and got really positive feedback, and said, well, here's a way for us to produce something that's relatively simple, that will be quite low cost, to enable people to, first of all, to log their food. So the glasses contain a small downward-looking camera. So you start eating, capture the image of what you're eating. It does AI food analysis of the calories, macros and micros.
Okay.
And then the glasses measures your eating rate as you're eating. And if you start eating quickly, it gives you this subtle vibration feedback to slow down your eating.
Okay.
It also can monitor when you're eating whilst distracted, because we know that people who eat distracted tend to eat more. If you're watching TV whilst eating, or if you're doom scrolling on social media whilst eating, you're not really focusing on the food and eating mindfully, which we know is important for weight management.
Can people choose their level of electric shock?
Yes, it's a subtle vibration, but yes, absolutely, it's configurable within the app.
Some people might need a little stronger nudge.
Yes. Yeah, absolutely. And actually, we know that if somebody's very, very active, as measured by so it has an IMU, it has a motion sensor as well. And if you're very active, then obviously you would likely require more of a feedback buzz. We actually have done some user testing about it to work out what level was satisfactory. And it does vary from person to person. But what was really interesting, that we found that by lowering the threshold, so if a person has an eating rate of, I don't know, say, 1.7 chews per second, you can lower it down by 80%, and the person will slow down their eating. And by doing so, you're actually having a direct impact on the GLP-1s in the stomach, because we know that. Yeah,
really, slower chewing increases GLP-1.
So one of the mechanisms by which GLP-1s are released are through the stretching of the stomach. And so one of the reasons why people often struggle with their weight is that if you eat quickly, you're going to ingest more calories per unit time. The mechanism by which this satisfaction or fullness signals is not through neural, but it's from hormonal. So it often takes like a 20-minute lag between eating the food and signaling that you're full. And if you eat too quickly, you're going to stretch the stomach, and it's too late by that stage. You've overeaten.
Got it. Yeah, you can out eat the response, the feedback loop, so to speak, right? Yeah. Interesting.
By slowing down your eating, you give a chance for the brain to recognize that it's full faster.
Got it. That's fascinating. So have you done some weight or body composition studies to kind of demonstrate what happens for people like this? Is it done in conjunction with bariatric surgery, or is it now standalone, or how does that work?
So our work on diet is ongoing. So we have just completed one clinical study on patients, just to prove that technology works in the wild, where people are using glasses to have the app, is capturing all their meals, giving them feedback. And it was quite surprising how patients were finding it really valuable. So one of the patients, she had been seeing a dietitian for years, or for months, I should say, with really bad heartburn. And her dietitian had told her to stop eating tomatoes and these acid-rich foods, eat more bread because it can soak up, the stomach acids and the like. And her symptoms weren't getting better. But because the app was showing her what she was eating and she was able to relate to her symptoms, she realized actually it wasn't that at all. The bread was the thing that was causing it. She had a wheat intolerance.
There it is.
And,
Yeah.
and so we see the glasses as having this role in weight management, which almost certainly beneficial. We know that logging food, by whatever mechanism, will help people to lose weight. But being
Yeah.
able to identify the causal relationships between what you've done, i.e., what you've eaten, and your bodily symptoms later on will be really
Yeah.
powerful.
Cool. So it's really an educational tool, quite honestly. It's also a training and educational tool in a way. Yeah.
Absolutely.
Very cool. Yeah, that's awesome. So what are the plans for this? Do you plan to make it generally available, or it doesn't sound dangerous. It doesn't sound like there's contraindications to it. I suppose there's a contraindication to everything, but
Yeah, I mean it's a very low risk technology because it's just providing you with the information.
yeah,
And the idea being that if you can empower people with better information, they can make better decisions. And it's glasses, and so glasses are there to help you to see better. In this case, you're seeing better what things you're doing today that will lead to a negative outcome tomorrow.
right.
The route to market will likely be via dietitians or through platforms who are managing people's health. But to be honest, given the scale of metabolic diseases, given the impact of what people are eating on their health, I think we're quite surprised. I mean, when I was wearing the glasses myself as part of that sort of testing, it's really interesting to find out how often I was snacking without realizing, because we just do it mindlessly,
Right. Totally. And so there should be somebody outside of every all-you-can-eat at restaurant and it's handing them out, right? So yeah.
Well, it's always
chased away by the proprietor, though. So, or maybe not. Maybe they're going to pay one price and eat less, so everybody wins.
Yeah, that's true. That's true. That's really the idea.
Right. That's funny. Very cool. Very cool. So, how do people find out more about you and what you're doing if they'd like to connect or learn more? What's the best way to do that?
So our company is called EMTEQ Labs. That's EMTEQ Labs.com. And basically, we have a lot of information about our technology, our research, our background. We've done a lot of work on the various health parameters that can be measured via eyewear. One of the things that I'm really passionate about is that we enable people to have better information around what they're doing and how it can impact the future. And also the fact that so many of the things that we measure in medicine and in longevity science, for that matter, are the after effects of some kind of behavior. So, you can measure blood biomarkers, or you can measure
That's right.
assays or imaging, but very often what you're looking at are the net effects of an accumulation of behaviors. And eyewear is very, very interesting because it gives you really unique data, apart from around mood and emotions, which obviously is really powerful. We know this from studies published by Harvard and others about the impact of various factors on longevity, and the most important one being about being grateful and sociable. And obviously you can measure all those things with glasses, because people who are sociable tend to interact more, they smile more, more positive, and people want to be around them. But also on things such as subtle things such as one's posture, one's gait. So being worn on the head means that you actually can measure gait in ways you can't do from a wrist-based device such as an Apple Watch or a Fitbit. You're getting much better information around asymmetries, for example. So before you develop problems in your hip or your knee, it may not be visible in the data as a digital signal. People's posture changes very, very slowly, so much so they don't notice it. And so you can measure these things over time and actually give an indication that this person is no longer as upright and sprightly as they used to be.
It seems like it might have a general application in any physical therapy setting and almost any psychological setting as well. If you're sort of training people on this, smile and you'll feel happier kind of thing. or pay attention to your gait or whatever it is, right? So it seems like it has broad application. Um, you had a statement about, I think it was the longevity of joy or something. Tell us a little bit about your connection to joy. What's your thought there?
So one of the things that was quite interesting to me is that there's an old saying. I think it was Peter Drucker who said it. We can manage what we can measure. And for a long time in medicine, and actually most hospitals today, they focus on making people live longer. As a plastic surgeon, I often get involved in managing people who are very elderly, not only doing facial paralysis, but doing things such as skin cancers, etc.
Mm-hmm.
And sometimes people are being kept alive, but have no quality of life. And that's a terrible thing.
Yeah, totally.
And so, the focus on health span, I think, is great. It's wonderful. But then you see some people who are going at this health span drive, but they're living miserably. They spend 4 hours in the morning, having to prepare specialized meals. They have a routine that is so arduous and tedious that, it may not be that they live longer, but they may feel longer because of
it's like a calorie deprivation, right? It's chronic. So
exactly. So if we could think about how can we optimize for not just the length of life, not just the length of healthy life, but the length of healthy and joyful life, and that will hopefully make life worth living. And how do you measure that? Well, you can measure that by looking at things such as emotions, things such as interactions, so that you make decisions that are perhaps a little bit more informed.
Yeah, I think that's fascinating. In the book that I wrote, 100 is the New 30, it was about living young for a lifetime. And we've kind of gone on to really, the target for us with longevity is when we're 100, we want to have a 30-year-old body, but we want to have a 300 to 3,000-year-old mind, right? Which is all the equanimity, all the joy, all the love, all the perspective, and the ability to actually suffer a trauma and be minimally impacted by it because of the perspective and sense of well-being that we have innate to us. It's not external validation, it's internal assurance, if you will, right? So, so we love that because we find that so many people not only destroy their health with stress and worry and things like that, but they also are just exceedingly unhappy. And so if you're not addressing that, what I call the life energy circle, to talk about all those different components and healing traumas and all the things that go on there and feeling safe and feeling loved and having great relationships, then and also being open-minded, right, to grow and learn, then it's what's the point, really? And I think you're right. What's the point? But beyond that, the flip side of the what's the point conversation is if we step into this new concept of longevity where we truly are youthful and can do whatever we want, but we also have this wisdom and perspective, oh my gosh, I think humanity could really elevate itself beyond this kind of binary, thinking that we seem to be caught in, right? Kind of move into more of a quantum perspective on, where are the best solutions as opposed to we're right and you're wrong kind of thing, which leads to all kinds of conflicts. So anyway, that's kind of where we're pointed. Yeah.
Love it. I mean, we can see it today, can't we? We can see, some of the richest people in the world, and I'm not mentioning any names here, but they clearly are not very happy.
No, that's right.
So money won't buy happiness.
That's right.
And the research backs that up. As you all know, the research that showed that, the household income required for people to feel happy, it tops out at this level that's much lower than people would imagine.
That's right. That's right.
When the study was published, it was $80,000. It may be higher now, but the fact is that, I see this in patients of mine, having more money isn't necessarily the route to being happier.
That's right.
So, but if you can't measure certain things, you can't make decisions. So if you're going on your journey on a map, you've got two routes to go by. One route is going to go via the freeway, and the other one's going to go via the countryside. If you have no way of being able to judge the value of that journey in terms of what it's going to give to you, you may just choose one or the other based on time. Mm-hmm. But if you knew that journey along the countryside was going to be beautiful and you'll see lovely fields and nature, you may choose a journey that may take longer.
That's right.
It's filled with more joy.
That's right.
but it's actually quite hard to measure that because there aren't the tools there to
Mhm.
measure joy in the wild. We have systems that we can use to kind of measure past experiences of other people. Rating
Yep.
systems, like, for example, you can say, okay, well, that restaurant is good because it's got good ratings. That hotel's good ratings. What if we could map emotional experiences across the map, so
Mhm.
that people can actually work out based
Yeah.
on wisdom of the crowd the
Yeah, I
places.
think it'd be great to be able to measure joy. I don't know if you can do it just with facial expressions or if you need to look at, dopamine and oxytocin levels or what exactly you need to be measuring, right? But certainly, for me, joy has really become a North Star. It's like if I'm not feeling joy, then maybe I need to rethink how I'm approaching this, or maybe I shouldn't be doing this, right? So those are kind of my two things. Yeah, for sure. No, I think yeah, we're one of the insights I've had recently is that when we're born here on planet Earth, we're actually born into a giant escape room. Yeah, and the goal is to actually work our way out of all the constructs that we're laden with, right?
Mhm.
Both epigenetic and social, to find our freedom where we're actually unencumbered by these things, and we actually connect to source energy, and we're actually just self-actualized, if you will, where
Mhm.
we reference against source. There's no external validation required, and yet we're free to have many loving relationships, and we're not attached to outcomes, which is really the source of stress, right? We identify with an outcome, we attach to that. It's like, well, there's no need for that, quite honestly, right? What if I just love and care and connect, but I don't have to be attached to it, and it frees you up. All of a sudden, you're emancipated. It's like, well, okay, now this is joyous, right? I want to live this life for a long time, right? Instead of like all the drudgery of, am I going to lose my money? Is my, this or that, all the things that people worry about. So anyway, that's to give you a little bit of a taste of kind of what we're up to over here. So
No,
yeah.
that's fascinating. It's funny. I'm actually reading a book at the moment called "I Am a Strange Loop" by Douglas Hofstadter, and there's a section in there. He talks about the relationship between us as individuals and our place in the world, and how we are. The optimal position is that we become one with the world ultimately,
Mhm.
because there is no mechanism by which one's actions can't have an impact on the whole universe if you think
That's
about
right.
it, to its extent. So
Yeah.
um, yeah, it's a
Yeah. We're
really
more powerful than we realize, quite honestly.
yeah
That's the other thing. Right.
yeah.
So it's an escape room. The idea is to work your way out of that to get there. So anyway, that's the analogy I'm using at the moment. Well, I love the work that you're doing. I think it's really refreshing to meet any physician that's really thinking about things from a greater perspective, if you will. And, no pun intended, but particularly a surgeon, right? So you have your reputations to live up to. Like interventional cardiologists are not, we're kind of in the same boat. But yeah. So anyway, that's really lovely to see the work you're doing. So what's next for you? Do you have other devices, other plans, other
Well,
charities, other activities?
the main plan is to get this technology. So this is going to be Sense I, where we're launching a dev kit for developers to get access to technology to build apps on top of our platform.
Okay.
Imagine that, for example, someone who has a specific issue, be it perimenopausal health, or it
Hmm.
could be somebody with a specific gut disorder,
Yeah.
who may need to manage it with a specific kind of diet, or somebody who has sort of lifestyle related issues. It can really provide them with information they need to make actionable decisions.
Hmm.
More information, the right kind of information, will hopefully lead to better outcomes. And so
Yeah.
that's North Star. So we're looking forward to partnering with organizations, companies, clinics who want to take
Great.
this technology to their clients, to give them
Cool.
this really previously unavailable information.
Hmm. Yeah, we're building a longevity coaching app right now. It might be great to actually
Oh,
collaborate with you and bring the glasses into that arena. That would be super cool. So, yeah,
wonderful.
yeah, awesome. Well, Charles, thank you for taking the time. I think, where are you speaking to us from? Are you in England or someplace
Yes,
close?
yes. I'm
Oh,
in Brighton on the south coast of the UK, and
okay,
um,
got it.
yeah. So it's what time is it now?
It's what, 8 o'clock, maybe
No,
9
no,
o'clock,
it's 20 past 10.
20 past 10. Okay. Well, you need your sleep, so I'll let you go. Thanks for taking the time, though. Really a pleasure. Thank you.
Thank you for listening to this week's episode of the Gladden Longevity Podcast. If you would like more information on what we've discussed or other topics, please reference the show notes or go to GladdenLongevityPodcast.com. You can also find us on Instagram, Facebook, and Twitter by searching Gladden Longevity. If you've enjoyed this podcast, please subscribe to get future episodes delivered to you and share our podcast or this episode with someone in your life that you may find benefit. Thank you for listening. We'll be back next week with another exciting episode. The Gladden Longevity Podcast is provided for informational purposes only. It does not constitute medical advice. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with any questions you may have regarding a medical condition. The use of any information and materials linked to this podcast is at the listener's own risk.